Hi, I'm Dr. Eric Wilkinson, one of the neurologists at the House Clinic. Dr. William House and Dr. William Hitzelberger were pioneers in the development of a team approach to the management of acoustic neuroma and other skull-based problems. This allows for the patient to receive the benefit of the experience and surgical skill of both the neurosurgeon and the neurologist in the management of the problem. Today at House Clinic, we continue the legacy of Drs. House and Hitzelberger as we continue to manage patients as a team to provide them the best outcome possible.
So today I actually had two middle fossa cases. So the first middle fossa was an acoustic neuroma, and the second middle fossa case was a case where the patient had brain that had unfortunately herniated down into his ear. So I had to take the brain out of the ear and reconstruct the ear.
We're doing a far lateral approach for a very large meningioma, and we combine traditional far lateral approach, which is a neurosurgical approach, with a retrolabyrinthine approach, which is a neurotological approach. So one of the advantages here at House Clinic is we have neurotologists and neurosurgeons working together, and we're able to combine expertise. And in this case, the advantage of doing the retrolabyrinthine approach is it will remove the blood supply of the tumor before we take it out. So it's nice to be able to do that for the patient. This is a very large tumor, and it's an example of what we do here at House Clinic in terms of taking out very large tumors as a team.
Today we did middle fossa craniotomy for a small acoustic neuroma. So this is a patient who had mostly dizziness actually. And this was a significant problem. There was a small acoustic neuroma. He still had very good hearing, so our goal was to take the tumor out and preserve the hearing. When we do this operation for somebody with dizziness, we know we can never make the balance nerve normal. So our goal is to cut that nerve, and that gives the brain an easier time compensating and learning to live off the other side. So we can actually help with their balance symptoms and improve their quality of life by doing that operation.
We just finished a surgery right now to repair what's called a skull-base encephalocele, which is a herniation or prolapsing of the brain into the ear through the floor of the skull. And that's a condition that's dangerous and can lead to meningitis or other infections.
This has been a pretty typical week in the House Clinic surgery schedule. We've had many skull-based cases this week. Today there were 3 skull-based cases. There was a retrosigmoid removal of an acoustic neuroma, there was a middle fossa removal of an acoustic neuroma, and there was the middle fossa repair of an encephalocele.
This is a middle fossa approach for a small acoustic tumor. This lady has had a hearing loss in her left ear, and an MRI revealed a small acoustic neuroma. And there are various options for approaching these, but for hearing preservation, we do this approach going above the ear called the middle cranial fossa approach.
When asked about patient outcome, I think there are several factors that we should discuss. One, of course, is the environment of the operating room. It's the personnel in the operating room, and of course the ability of the surgeon. We're very fortunate here at the House Clinic and St. Vincent's Hospital in that we have the same personnel working with us day in and day out. We have the same instruments that we have always used, and so therefore we're able to do surgery in a very efficient manner.
We can perform both our inpatient and outpatient surgeries in a dedicated setting. You've heard about our personnel that work together as a team. Part of the importance of working with St. Vincent's is what they have, Seton Hall. Seton Hall is a boutique hotel that allows families of our inpatient to stay and be with their loved ones during their time that they spend here in the hospital.
We try to do all our surgeries here as a team, both with neurotology, otology, or temporal bone surgery, and neurosurgery.
The House Clinic staff works very well together. Fortunately, we've had a good group of nurses that have been with us for many, many years. We consider ourselves a team approach, so we have a team of anesthesiologists, a team of nurses, a team of recovery room, ICU nurses, and also monitoring people, and we all work together. So fortunately, these nurses, anesthesiologists, monitoring group are all very comfortable with the type of skull-based approaches that we do, and are also very comfortable with dealing with patients with these skull-based tumors.